integrate some stress relief techniques that I've been using, because I don't know about you guys, but this last week especially has just been so heavy, not just with politics, not just with, school and COVID and all that, but also just with, it seems like social and personal situations are really blowing up too. Like everyone seems to have a personal issue. So canceling that noise out is really, really, really hard, especially when you're personally invested, emotionally invested in things around you, in the success of others, in the success of systems that you're a part of. So right now, I want you to just actually focus and think about some of the stressors you've had this week. Not fixate on them, because I think that's what we've been doing a lot of, is fixation. Maybe just let's call this a time of identification, where our inhale, we're just welcoming in white light, welcoming in purity, just fresh air. On the exhale, we're really focusing on those things, those fixations you've had, one at a time. Just let them go. No more thought. Sometimes I find that taking a deep breath into the nose, if you measure it in 3 increments, the first breath, we're only breathing in halfway. And every exhale, all the way out. So there's no breath left in our lungs. Second time, 3/4 in. And all the way out. The last time, all the way in. So your lungs are at capacity to hold that. Make that your safe space. And exhale. You've sort of got those things in your brain that have been bugging you this week. Kind of capture those, throw those out of your brain if you can, along with the things you were doing before this, the responsibilities you have after this, your schedule. In this 90-minute session, none of that matters, and to release that is going to let us do the best possible self-care for ourselves. And always take care of those things afterwards. Honestly, the world is standing still right now, so there's really no need to fixate on that right now. Just focus on your breath. It's a special time where there's only 5 of us here right now. It's a small class, which is really nice. How nice it is that we can all share this moment. When you're ready, when you've sort of breathed out some of these stressors, you're feeling a little bit more grounded. I want you to really think about what grounded means for a moment. Think about where you're sitting. What's the surface like that you're sitting on? Is it a chair? Is it the actual ground? What floor are you on? Are you on the ground floor? Are you closer to the earth? Are you elevated like me right now where you're on the 3rd floor? Whatever it is, try and connect yourself to where the dirt is underneath you. Even if that's a couple stories down, it's okay. Think about the frame of the building you're in that's supporting you on the earth. Think about the earth itself. Firm, it's grounding you. When we say grounded, you yourself are in this position on the earth, where the earth is cradling your body all the time. Don't really think about it that way. Especially right now when we're just still. Just be still and be cradled by the earth. Let your weight just sink into the earth. Take a deep breath and really feel your weight just relax. Relax your shoulders, relax your neck. Relax your hips, your spine. It's not about good or bad posture right now, it's just about support. When you feel really grounded, imagine that you're just flying outside of your body. Real quick, we're ejecting ourselves. Remember where we are in our building, on the earth. But eject yourselves past that. Zoom it way out. So now we're looking at the earth from space. We know where our tiny houses, we know where we are. It's difficult sometimes because we're so engulfed in all this noise, this human created, that we forget really just how small we are and how just we're just a dot on a planet, and we're a planet is a dot in the solar system. Keep backing it up. Keep backing that camera up a little bit. Staring at the earth from where we are. A lot of things happening on the earth right now. A lot of things we can't control. But what we can control is our internal dialogue. How we feel about ourselves, how we treat ourselves. Sometimes I think we sacrifice ourselves to our missions. Taking care of the kids, getting good grades, finding the next job, the next best opportunity, the next best content we can create, in my case, next best treatment. But we are humans. We're just organisms. We're supposed to be living our best lives. Now, from your camera view of space, I want you to just now that we're stepped away from our bodies for a second, just think about how you can take this time to recharge yourself so you can live your best life, totally apart from the tasks that you're engulfed by right now, the stressors you're engulfed by. You're a life, a valuable life that was really just put on earth to live. When you're ready, you can kind of descend back down, come back into your body, and really, again, feel that comforting earth underneath you. Just remember where you are, that you are grounded. Put your hands on your diaphragm if you want. That's located right here at the bottom of the rib cage. This is an area I think that's really uncomfortable for us because we both of being seen. It's the area of exposure we don't like to be seen, but touch ourselves can sometimes be comforting just to put your hands here and when you're grounding. Take a deep breath. Let exhale, just relax those shoulders, relax the neck. Come back into your body. With your hands still on your diaphragm, I want you to just start at the head. We're going to work our way all the way down here. I want you to just really think about how your body's feeling right now. Now that we've exited ourselves for a moment and we've looked at things from a different perspective, let's come back into our bodies and really ask ourselves how we're feeling before we get started with work today. With our head, do we have a headache right now? Where is that headache coming from? We do. How do our ears feel? I think the big points of anxiety, really, if you follow the spine, that's really where our anxiety is held. It's here, the diaphragm, going up. It's here in the chest, going up. It's here in the neck, our clenching, our jaw, our head. A lot of times our headaches aren't migraines, they're just muscle tension. There's so much stress, so much worry and anguish, we would call it. Think about your head and how that's feeling. Ask yourself really where your headache is coming from. Is it diet? Is it hydration? Is it tension? There's a lot of worry around this area right now, especially with COVID-19 being so rampant right now. You know, like you get one symptom, especially this time of year, it's cold season, you know, like you get one symptom and you start freaking out about it. That worry can amplify. The body and the mind are connected. We start thinking about being ill. Sometimes it's easy to just have our immune system be weakened or have our defenses be lowered. So think about it here. Move down from the head now to the jaw, to the face, to the neck. Be honest with yourself. Do we feel fluid here? Does it feel puffy? How does our skin feel? Our neck. How do our lymph nodes feel here? Again, another thing of worry. Our lymph nodes are our main defense. A lot of times they can swell up just from our body fighting off a pathogen, COVID or not. It's a good thing. It's our body functioning properly. If you do feel fluid here, that's okay. We're actually going to address that today. We're gonna do some facial massage and we're gonna bring the fluid out of here. We're gonna massage the neck a little bit. Put your hands here. Feel your neck. When you squeeze your neck in different areas, are you feeling that refer up into the head? A lot of our headaches and muscle tension come from these neck muscles right here. Back, the side, the front of the neck. All have muscles that articulate with our headaches. When you're ready, come down to your clavicles here. Put your fingers right there, right at the top of the clavicle. Is that referring to the neck of the head? Again, these muscles here in the front are called SCM, and they are big movers for the neck, and they're big causers of headaches. Does it feel uncomfortable to just be in this area right now? For me, it does a little bit. Let's move on to the back, spine. Where are we feeling our tension? If we're chronic sitters, I'm sure we're feeling it in our mid back, our upper body, maybe even our low back. This is all telling us something that we should know. If we feel the tension in the shoulders and the upper back, It's probably because we have a forward-leaning posture. If we're feeling in the back, mid-back rather, it's probably because we're hunched over a lot. And if we're feeling it in the low back, it could be because we're crossing our legs. It could be because we're not active enough. We're sitting too much. These are all things your body's just trying to tell you. Again, before we do any stretching or work, these are the things we should be thinking about. Where are we feeling that tension? Where are we feeling our pain? Totally separate from stress. What about your hands, your arms, your shoulders? How does that feel today? Started fostering a dog recently. He's massive, so my right arm is very sore from being pulled. Little things like that. What actions have you been using your arms and hands for recently? Really reflect back on that. Maybe even putting your body through recently. I'm going to take deep breaths from these places. We're assessing, but we're also breathing. Bringing oxygen into the tissue, helping to oxygenate, to flow, to bring blood flow. Every exhale, remember to relax the shoulders, relax the jaw, especially the jaw. Jaw is an area we clench way too much. Lastly, we're going to make our way down to the lower body. And I think a big indicator here is think about how you're sitting right now. What leg is crossed over the other right now? Are you crossed at all? Are you kneeling? Are you sitting? Our body loves to compensate for pain by crossing our legs. You know, one is sore, one doesn't want to bend too much, we'll cross that leg. Sometimes we don't cross the other leg enough for crossers. It's sore, it's restricted. Keep working your way down. How do the hamstrings feel? How do the back of the legs feel? The back of the knee. That's the articulating zone for the hamstring. The hamstrings actually attach in the hip, in the back, and then they go all the way down and they attach behind the knee. Sometimes that behind the knee pain you feel, that discomfort, is actually the hamstrings just getting tight. Hamstrings are also a huge cause of lower back pain because of their attachments. How's your back? How's your hamstrings feel? Remember to breathe. Lastly, we're going to work our way down to the feet. Our least addressed area. We do some self-care with our feet. A lot of us get pedicures sometimes. Sometimes a nice refreshment, but I think if you've ever gotten a pedicure, you know exactly how you feel afterwards. It's this sort of relief, like you've seriously been taken care of, like you've been grounded by someone else. I think that's because we sort of ignore our feet a lot. They're just in shoes, they're covered, they're compressed. When was the last time you massaged your feet? When was the last time you did some self-care yourself with your feet? We're going to take one last deep breath. And we're going to sit up. If you can, if it's comfortable to, we're going to go right into a kneeling position here. Again, sometimes it's difficult to be in these positions because of discomfort we have in the ankles, discomfort we have in the legs. So if it's uncomfortable for you here, what you can do is you can take your toes and you can just sit back like this. You don't have to totally kneel if you don't want to, but if it feels good to kneel, go ahead. From here, we're going to start with a low back. It's my favorite low back and hip stretching position. What we're going to do is we're going to crisscross our front leg. In the front, we're going to start with our right side. And with the left, we're actually going to drop our knee out just like this. Spread your legs as wide as you feel comfortable. And you're immediately going to feel on one side of the back, it feels very tight. And that's because what we're trying to do is we're trying to sit up straight, and our pelvis is seldom in alignment. I know mine is not. So it's normal for you when you sit up straight, when you try and sit in this position, it might feel uncomfortable in the one leg, and it might feel uncomfortable in the other side, the articulating back. And that's normal. I'm just going to sit in this position. We're going to take a deep breath into the diaphragm. On the exhale, we're going to just take our hands, put them right in front of us. We're not going to go too far. Exhale. And what we're doing here is we're just trying to gradually open the hip. This is an easier or more difficult pose for different people. For me, I do this all the time, so it's a little bit easier. What I want you to do in this position is we just got our hands right out in front of us to support us, and we're just going to take ourselves through a little bit of leaning. Call this constructive leaning. We're just taking ourselves, we can move our hands a little bit, and we're just trying to move ourselves around in this position, give our hips a little bit of mobility here. Because when we're sitting all day, we're sitting like this, or we're sitting like this. And our hips aren't getting the mobility they need. Even when we're walking, a lot of times we're just using our legs, we don't really engage the hip. So here what we're fully doing is we're engaging the hip. If this is easy for you, what you can do is you can stretch this outer leg out just a little bit more and really dig that knee into the mat. Again, we're just going to keep constructively leaning. What we're doing here is we're warming up. If you'd like, you can do a little twist. I love the twists. And when you're ready, we're going to switch sides. Again, we're just warming things up right now before we really get into some deeper work. So we're going to switch sides. Again, one leg is dropped like this. The other is crisscrossed in front of us. If this is an easy pose for you, you can take your leg, your outer leg, and you can stretch it a little farther out. Again, our intention here is to sit up straight, to open the pelvis. This side is much harder for me in the leg. And again, we're going to take our hands, put them right out in front of us, not too far. Oh man, even visually, this looks more difficult for me on this side. And take notice of those things. Which side feels more difficult? Which side do you look more uncomfortable doing? We're going to just do some constructive leaning here. Again, just trying to open the pelvis. And if you find an area that feels pretty tense, lean into that a little bit more. Take your time. What I'm going to suggest is taking a deep breath. On the exhale, leaning into that, not all the way, right till we feel a good stretch. Exhale, and come back. We're going to do shake it out, whatever position we were in. If that's this way, shake this leg out. If it's this way, shake this leg out. We're going to do, take another deep breath. Same position that felt restricted before, but go just a little bit farther this time. What we're going to do is we're going to switch sides, back again. Now that we're feeling a little bit more warm here in the pelvis, we're going to do a little bit of rocking to start out. So just get in this position, we're going to rock back and forth. Might feel a little bit of crackling in the hip, and that's okay. That's just the joint opening a little bit. When you're ready, we put our hands down on the mat before. Now we're going to go about halfway forward. Not too much. Again, take a deep breath. Keep the spine straight, and just try and relax that pelvis. When you're ready, you're going to move to your outside leg. Same thing. We're going to just try and put our hands on the mat. Deep breath. Exhale and relax the pelvis there. Try and keep the spine as straight as possible. Mine's not great right now, but we're also twisting. And we're going to go to the inside leg here. Same thing. Put our hands down. Just lean into that deep breath. Exhale and lean into it. When you're ready, we're going to switch sides. This time we're going to go all the way forward. Take a deep breath in through the diaphragm, sit up straight. And we're going to go all the way down, forward. If you can, touch your head right to the mat. Lean right into this inside leg. Take a deep breath. And if you can't go all the way, that's fine. Just try and work on this. This is a position that requires time and requires work. When you're down here, really just work on relaxing the leg. It's easy to want to clench. That's your body's response to stretching sometimes. But just try and really lean into this and just let it relax. And we're going to hold that for 10 seconds. 9, 8, 7, 6, 5, 4, relax the leg, 3, 2, and release. We're going to come back up. If you'd like, this inside leg, it's much easier to go with. We're going to lean right into that same thing. Give your dog a hug. Deep breath. 5 seconds. 4, 3, 2, 1, and back. And this time we're going to take our arms, bring them right up in the air. And we're going to just lean to the outside leg. We're going to hold that for 10 seconds. 7, 6, 5, 4. You should feel a stretch to the ribs. 2, and release. If you'd like, we can go back the other way. You can put an arm right down if you want. Deep breath. 9, 8, 7, 6, 5, 4, 3, 2, and release. Shake our shoulders out. We're going to switch sides. This is our final approach here with the hip stretching. We're going to take our hands. We're going to bring them all the way out in front of us. Deep breath. Go all the way down. Creep your way down. Open that hip up again. One side's going to be a little easier than the other. So just be patient with yourself if you can't go all the way. But if you can, really work on leaning into that hip, taking a deep breath and relaxing the hip and just letting it go. And come back up. Keep in mind, this is a great pose to be doing anytime. I love to do this when I first wake up because I find that when I sleep, my pelvis is a little bit off. And clients that I have that I recommend this stretch to actually find that if their pelvis is out, their joints out a little bit, this sometimes actually just puts it right back in. Because we are helping to engage the pelvis, which a lot of times with a lot of stretching we're doing, we're really only stretching the leg. We're not really engaging the pelvis alongside it. So again, this is a great stretch to do just if you have low back pain at any point. Again, let's open up this posture here. We're going to take a deep breath, inside leg. We're going to drop our arm. Open it up. 3, 4, 5, 6, 7, all the way to 10, 9, 10. I don't know why I counted up that time. That was weird. Same thing. Let's roll the shoulders out. We're going to put our arms up in the air. Deep breath. Stretch all the way over. 9, 8, descending this time. 7, 6, 5. You should feel it through the ribs. 3, 2, 1, and back. Now we're going to just do some more twisting. Really just open up this pelvis. You can go any side you'd like. What we're going to do when you're ready and you're done with that, I'm going to have you just grab your legs here in front of you. We're just going to do a little bit of rocking. If your pelvis is still feeling a little bit out, what we're doing is we're balancing here on the sacrum, which is this little block portion of the spine right here in the back. And doing a little bit of rocking here can do a lot to put that back into place. You can go forward and back. Hello. We're just doing some rocking here, some pelvic rocking. We just finished up some low back stuff. What we're going to do, again, following the trend of low back, when you're done with your rocking, what we're going to do now is we're going to open up the hip flexors and the glutes. So if you're just logging in, this is actually a great time to log in because we're going to get right into some great stretching here. This is sort of an adaptation of what some people call the world's greatest lunge or the world's greatest stretch. It's kind of an adaptation of that. So what we're going to do is we're going to have one leg forward here. I'm going to start with my left side. My right side is going to be digging right into the mat here with the knee as the focal point in the mat. And what we're going to want to be doing, again, focusing on the knee here, we're going to be wanting to use the knee as a ground, almost dragging it, I might say, as a means to open this hip flexor and open the glute here on the side. We have 3 glute muscles. We have the glute max, the glute medius, and the glute minimus, which are all here on the side. So what we're doing is if we get into this pose, we can stretch all 3. So again, we're going to make a right angle here with our hip. This is just meant for stability, and we're going to kind of want to lean our trunk into that. So if this knee is the focal point on the mat here, we're going to want to dig our knee right into the mat. Deep breath. And we're going to just lean forward as much weight as you'd like. We can use our arm as stability here, and we're going to just kind of keep our knee glued to the mat there, opening the hip flexor all right in through here. And if you'd like, you can invert. You can go to the side of the knee here. And that's going to give you an even better stretch there, opening up. The hip flexors actually cause quite a bit of low back pain. It's a really weird kind of low back pain. So this is a really good one to quickly relieve low back pain if you're ever struggling with that at work. And we're going to come back. And this time when we come back, we're going to sit right on our foot here. If you can't go all the way back on your foot, what you can do is you can just put your toes on the mat. Really works the same way. But if you can go all the way down, it's better. And what we're going to do, we got our leg straight here, and we're going to just grab our leg. Grab our foot. I'm actually going to come up. This knee's really sore. And what we're going to do here is we're literally just going to grab this. We don't have to do anything else but grab. If you can't touch your toes, really try and envision that you're grabbing the outside and inside of your foot. And what we're going to do is we're just going to roll it a little bit. We're going to roll the foot back and forth. This is going to open the hamstrings a little bit. And when you're ready, we're going to just grab the outside of the foot, actually. We're going to take a deep breath. And we're just going to pull that outside just a little bit, about 10% of our force. And shake the foot out. And we're going to go back into our lunge here. Again, try and make it as sturdy of a right angle as possible. Again, using the knee as the point that's digging into the mat. We want to keep that stable, even if our foot comes off the mat. We're going to take a deep breath. And forward with our lunge. And tilt there. Again, I've got my right leg digging into the mat here. So I'm going to avert to the right a little bit. And what this is going to do, if you'd like to readjust your hands, you can, so that your right hand's a little bit more in the center of the mat. What this is going to do is it's going to allow the bands that are opening to be the outside and the hip flexor as well. So what you can do is, again, if we're stretching the right side, we can look left. We can have our right hand planted, and we can look left, twisting with our body. Go as far as you feel comfortable. And when you're ready, we're going to come right back again to our hamstring spot here. And the thing is about this stretch, every time you do this, every time we go through it again and again and again, you're going to have just a little bit more mobility, which is how I measure success. I think when we try and force things too quickly, it gets really hard. So again, if you'd like to sit down on your leg, that's fine too. I don't know why I stress sitting on the knee. Just, I think it gives a bit better of a stretch. We're gonna grab our foot again. This time though, we're gonna focus on the inside. Grab the inside of the foot with the arm. And we're just gonna pull just a little bit, about 10% of our force. Now, as I was mentioning before, a lot of low back injury, a lot of low back pain actually does come from the legs, weirdly enough. The hamstrings run from the back of the knee into the pelvis underneath the glute. And so when the hamstrings become restricted, it's really easy to have this low back pain that seems unexplainable, but it really is a leg thing. So a lot of times when we stretch our legs, especially with this one, what we're doing here is we're stretching each hamstring individually. So when we're grabbing the outside, we're stretching the lateral hamstring or the outside hamstring. When we grab the inside, we're stretching the inside hamstring or the medial hamstring. And then when we're grabbing the middle of the toes here, we're stretching the center hamstring. So again, right now we're working on that medial one. And I'm spending a little bit more time here because I find that this one actually is the worst one. It comes up and it attaches kind of like behind the groin. You might feel it there when you're stretching. This one tends to be a real problem for low back pain. Get out of here. What we're going to do when you're ready, we're going to switch sides. Now we've got our right side forward. Our left knee is the point in the mat. So when we have a good solid position here, again, one side might be easier or harder to stretch. For me, I have a lot less stability on this side. So what we're going to do again, we're going to lean right into this leg here. Both arms on the inside of the leg. And what we're going to do is we're going to just open that hip flexor, again, twisting towards the top leg, again, opening the glute, opening the hip flexor. So we're going to look towards this top leg. And if it helps, you can use this arm. I coach skaters and surfers too on positioning. And a lot of times in skating, especially surfing, the arms, the shoulder placement, the eyes, all kind of determine what the lower body's doing. So with this is actually a really good training mechanism for this. When we're in this position, twisting the body, taking our eyes, taking our shoulders, and checking where we're going. And when we're ready, we're going to come back. We're going to sit right back on our knee. And this side is so much easier for me to sit on my ankle. I know I've had previous ankle injuries on this side, so it makes sense. But again, if you're having trouble being in this position, you can either have your foot up with your toe like this, or you can even just sit down. Whatever is easiest for you. Me, I'm going to do it the hard way. We're going to sit back. We're going to start with that outside hamstring. We're going to just grab that foot. We don't have to yank it. What we're doing is we're using about 10% of our force, almost like you're just holding on to something. You're using your arm for this. You're not using your leg. What you want to do is relax the leg as much as you can. We're not trying to yank this. We're not trying to stretch it crazy. We're trying to open this up. And again, for the purpose of relieving lower back and hip pain. you like to, what you can do is you can grab even lower if you're really flexible. On this side, I'm a lot more flexible. And when you're ready, we're gonna come right forward. If you can do it in one movement, that's great. Good for you. Again, we're gonna check our line, as I would say. So we're gonna lean forward, using the knee as the focal point that we're dragging. Almost imagine dragging the knee. And we're gonna check our line. Lean forward, relax that hip, open it up. Bro, this dog loves this bone. That's crazy. Dogs love bones. And when you're ready, we're going to come back. This time we're working that internal hamstring. Again, however you'd like to sit is totally fine. We're going to grab the inside of the foot now. That's tight. Again, right after this, we're actually going to switch sides again. And I want you to keep in mind, how does your mobility feel after doing this one time and do it on both sides? For me, I know I always feel so much more mobile. This is actually one of the things that I love to do before I go out and skate or surf, because it just really warms things up and it gets everything in my lower body working. Which really, if you think about why we have pain in the lower body, low back, glutes, even sciatica, it's really due to a lack of function, not something being tight necessarily. So I think lots of things are tight in our body, but it's really that lack of function, or certain things are overworking and certain things are underworking, that really causes discomfort. So again, right now, we're really helping this leg to fire, and we're getting that working, which is gonna help the low back to feel better. So again, we're gonna switch sides now. We're gonna be having our, what side did we just do? We were stretching our right, so now we're on our left. Hello, Kyushu. So now we're gonna get in our right angle here. And we're gonna lean forward, dragging the right leg, the right knee is our focal point. And if you can get this straight, I'm impressed. I can't quite do that. I will one day, when I'm like a super crazy, flexible 30-year-old. That'd be a good place to be. I'd be stoked. And we're gonna just lean into that. And again, take notice. Do you feel more flexible, more mobile here? Is this a little bit easier? Even just incrementally, just a tiny bit. And that's the important thing. Now when you're ready, we're gonna come back. Same thing. This time though, instead of picking one side to focus on, we're actually gonna focus on both. Oh, this side's so tight. Kyushu. We're gonna grab both sides of the foot here. So bad, why are you yelling? Come here. Kyushu, come here. Again, we're gonna grab both sides of the foot here. Just allowing things to open up. If you can straighten the leg, that's ideal. Now we're gonna focus on the outside. Just gonna give that a little pull. My dog's getting into some nonsense right now. I can feel it. When you're ready, when you feel a little bit more flexible there, you're gonna grab the inside one more time. If you want, you can grab with both hands. Now what we're gonna do, we're gonna put both legs out in front of us. We're not working the pelvis at this point. We've done a lot of that. We're actually just gonna grab the two toes right in the middle of our feet. And we're gonna good stretch to that center hamstring here. Again, this is about incremental flexibility, getting just a little bit more flexible every time, making it a little bit easier. It's not about the flexibility, it's about the relief we're going to get from engagement of muscles. And from here, what we're going to do, we're actually just going to point our toes. And what you might notice is you're going to feel a little bit of pull here. And that's actually what we're going to get into today with our self-massage a little bit, is how this section of the leg, including the knee, is very affected by tension. And what we can do self-massage wise to relieve that. A little bit of toe pointing here, feels really good. Definitely don't do this enough wearing shoes. All right, you ready? We're gonna do just a little bit of stuff for the upper body, and then we're gonna move on to self-massage here. So what we're gonna start with thread the needle pose, but not after we get into our tabletop position, and do just a little bit of, I always mess this up. One's cat and one's cow. This is cat, I'm gonna call it. So we're gonna start with cat. We're gonna just arch our pelvis. Think of our pelvis like a bull, and with cat, we're tipping it forward. And we're gonna go into cow, again, tipping the bull backwards, arching the spine. Really push the shoulders, push into the mat. Deep breath. Exhale, go back into cat. Really tip that bull forward, head up. If you can, really give a good stretch to that rib cage too. You can lean forward a little bit. And back to cow. Someone's gonna call me out on this one day. And now we're gonna go into thread the needle pose, which is a great one of my favorites for the spine. So what we're gonna do, so we're gonna take our right arm, this is our needle, we're gonna go all the way up, and what we're gonna do is we're gonna thread right under the body, just like this, and we're gonna be laying on that space between our head and our shoulder, that neck space. Open it right up, we've got our other arm right here, and we're gonna drop it right in front of us. Again, if you didn't see, or if you're new to thread the needle, this is our needle, and we're threading it through here. So what we're gonna do again, thread all the way up, get a good stretch to the chest, and we're gonna go right underneath, right here, and we're gonna land right on that space between our neck and our shoulder. Open it up. This is a great one for relieving headaches. Arm can do anything, arm can rest. Arm can come forward depending on your level of comfort. Arm can split you. And what I want you to focus on when you're in this position, I want you to focus on just relaxing. Doesn't matter how far you stretch, we just want to relax in this position and try and decompress the spine. And when you're ready, when you come back up, make sure you do a couple of these pulls, because sometimes what can happen is you get a little stuck in that position. So make sure you really do some pulls, almost like you're pulling a rope. Open that up, and we're going to switch to the other side. We're going to open this right up again, looking up to the sky, opening the chest. And we're going to come right underneath, right on that space between the head and the shoulder. We're going to lay on our shoulder and open it up, thread the needle. Again, I know this can be a tough pose, so what we're doing, we're opening here, and we're threading the needle right onto this position right here. Okay, now that we've done that, we're going to move on to some self-massage here, but I want to give everyone 1 second to grab a topical. I grabbed mine and I realized it is totally empty, so give me 1 second. I'm going to grab a new one. 1 second. Okay. Does everyone have a topical? I don't want to make you turn your... I'll tell you what, here's the system. If everyone has a topical, no one needs to turn their cameras back on. But if you do need one, or you don't have one, turn yours back on, let me know. Okay, great. So what we're going to do, whatever's left in here, we're going to start... I think this is the most important thing I want to do today with self-massage, and it's one that I kind of have gotten into in some of my classes, but I think it's really, really important right now, especially that it's flu season. I really want to work on just doing a little bit of fluid drainage here. And I think there's like this understatement right now about skincare routine. The skincare routine does more, obviously, than just taking care of our skin. It's also really good. The technique of skincare routine is really good for draining fluid. So if you want to integrate this into your daily skincare routine, you absolutely can. Because of that, this topical I want to use today, I'm actually just using, it's just a little like turmeric mask stick. I really have been enjoying this recently to use. So whatever topical you want to use, if it's good for your face, go ahead and use it on your face. If you're not loving it on your face, then you can just kind of follow along with me and do just more of the neck stuff. So what I'm going to do, I'm going to apply just a little bit to my face here. Kyushu, come here. Come here. None of that. None of that. Come on. I'm just going to apply a little bit to the face here. We're going to start with, I think it's very important, start with under eyes. All the fluid buildup that we have here from post-nasal drip ultimately usually gets caught here in this space. This muscle masseter here is our jaw muscle. We have our ears, we have our eyes, and this is all of our nasal passage. So we're going to start by just drawing lines here underneath the eyes. We're going to work our way right down the side with the jaw. All the way down. When we get to our chin, we're going to bring it forward all the way down the jaw. And under the neck, under the chin, all the way down. And we always want to bring fluid back to the center, back to the core. Things get caught here. Excuse me. Go. Stop it. This is what happens when you have too many dogs. We're going to want to always bring things back to the core here. And what can happen sometimes is when we're doing fluid drainage, we'll do these little strokes, whether it's the neck, whether it's the face, and we won't ultimately try and bring it back to the core, which is the most important thing. We want things to recirculate. So start here under the eyes. And if at any point you want to apply more topical, that's great. We're going to just do a couple strokes here. Down the chin. And again, this is a great thing to integrate into your skincare routine. A lot of people like to use guasha stones. which are these stones that you can use to manually drain fluid. I'm not as big a fan of guasha stones because sometimes they irritate the skin. So again, we're just drawing circles under the eyes right now. And fluid here actually can cause headaches. Follow this line here. That's your cheekbones. Go around the cheekbones. And again, we're going back in front of the ears, down the jaw. And when you get to the jaw, I want you to pause here. And I want you to open your mouth. Open the jaw. I just did a jaw adjustment on myself last night, so I'm not really noticing any gait issues, but a gait issue is just when one side is opening or firing before the other. So take notice of that. Still notice it's a little bit of a gait issue for me on this side. When I say that, it means that this side is firing second. So this side's firing first because there's compression on this side. So you notice just a little bit. My jaw is averting just a little bit to the right. So when you get here, what I want you to do is just put a little bit of pressure there in the jaw, open up, and try and relax the jaw when you're in this position. This is really hard to talk and do it at the same time. What you're trying to do here is you're just waiting for the jaw just to soften a little bit. We're actually on a muscle here. Again, this is called masseter. So open that jaw, relax the tongue, take a deep breath. And eventually you're going to feel that jaw soften just a little bit. And what we're going to do then is we're going to bring our stroke all the way down again. Under the chin. Always back to the core. So if we need to, just make sure you really emphasize that. Bring it back to the core here. Start the eyes again. You don't need to be applying a ton of pressure here under the eyes. Really, the only place we want to be applying pressure is the masseter muscle. So here we can be as gentle as we really want to be, just helping to manipulate fluid and bring it out. And again, I do this every day, both for skincare and for muscular release and just stopping headaches. So again, if you've opened your jaw and you've identified that your jaw is moving one way or the other, what you're going to want to do is whatever direction it's moving more, that's where the compression is. So that's the side you're going to want to kind of apply pressure to first. So when you get to this position, we're pausing on the jaw again, the masseter. I'm seeing that my compression is on the right, so I'm really just place holding here with the left. I'm going to be applying just a little bit of pressure, whatever feels most comfortable to you. This isn't a contest. We're not trying to release something. We're just waiting for that to soften a little bit. And again, super hard for me to talk and effectively do this at the same time. We're just waiting for that muscle to just soften a little bit. If you'd like, you can pump a little bit. Again, keeping the jaw nice and relaxed, nice and fluid. And whenever you do feel that soften, you can bring your stroke all the way back down. You're going to apply whatever pressure you feel is good for you. All the way down, underneath. Bring that fluid out. And this is really good. Again, if you have postnasal drip, if you feel like you have just gunk in your ears, fluid in your ears, this is a really great thing to be doing. Totally separate from skincare. So now I want to point out this next space we're going to go. And right here, we were in our masseter muscle. Now we're going to go right here behind the ear, and this is going to help to bring fluid out of the ears. So we're going to start there. And again, for me, I'm really focusing on my right side because that's where I feel my compression is. So this is kind of a feel game for you guys. Figure out where you're feeling that compression, where you're feeling that pressure. And we're going to just trace our jawline, starting here real slow. all the way down. Try and relax the jaw. It's the most important thing. We're going to go right under the jawline here with our fingers. And all the way to the front. And again, bring all the fluid down. I'm already noticing a difference with the fluid that I was feeling in my ear earlier. It does not take long to do this. So if you're ever stuffed up or you have pain in your ears, if you have seasonal allergies, headaches, these are great first steps to take along with stretching. So again, we're in the same place. We're in this little space between our ear and our jaw, right there. And we're going to come all the way underneath again. Shh. I'm going to trace all the way down. You guys ever notice when you try and talk to your animals and then all of a sudden they're trying to get your attention? That's my mistake. Just got to ignore them. Go, go. Shh. No. No. I'm currently fostering a dog, so if anyone knows a fantastic home for a very, very nice dog, not this one. He's kind of big. His name's Go-Go, and he's looking for a forever home. That's not my small city apartment. But until then, he's happy and healthy. So now what we're doing, again, I am just putting my hands on my head here. I'm feeling out my headache zone here. Behind the ears, you'll feel little points back in here. What I want you to do is just apply pressure here. I know we're all pretty used to doing this, little head massages. We love to go to the salon and get that done, but what we're focusing on here are these points behind the ears. And I have my fingers here, again, in that jaw space. And I'm not pressing hard. What I'm doing is I'm just trying to spread my fingers apart. My thumbs are going down under my jaw. My fingers are slowly working my way up, and I'm trying to relax my head. Soften the eyes. Soften the jaw. Open it right up. And when you get to that point where you're all spread out, bring that fluid back down. Always more topical. I know this isn't your usual topical, but I was going to do this evening anyway, because I really like this turmeric face mask. It's really good for dry skin and inflammation. Turmeric's fantastic for that. What we're going to do, so we're going to move up to our forehead. We're going to start right in the center here. Our fingers can go on this little, we call this the outer cathis of the eye. This is the inner cathis. This is the outer cathis. We're going to have our fingers right on the outer cathis, specifically our thumbs. We're going to take the rest of our fingers, our fingertips, and we're going to drag from that outer cathis, putting a little pressure in there, deep breath. I really love this one. Drag all the way down till we get to the outer cathis. We're going to drag it right down. All the way down through the masseter, under the chin, always under the chin. I feel like this is where our fluid builds up. All the way back down. Now we're going to take a look at our shoulders here. I know we did a little stretch. Thread the needle is fantastic because it helps to open these neck muscles. But what we're going to want to do, let's just take our hand. I know we love to massage. We love to massage our shoulders. But let's really take a look in here for a second. Can you lay down? You're being a pain right now. Just feel in the shoulders and feel where we're feeling that tension. And ultimately, we're going to be working our way up. So I want you to identify levator scapula muscle, which is right here. It goes from the back of our ear all the way into our shoulder, and it's what causes our elevated shoulders. So we're going to just grab here. We're going to work our way all the way up till we felt the whole muscle. We're going to take our hands, just like this technique we were doing on the face. We're going to start here at the back of the neck. And we're just going to drag down slowly with our fingertips, whatever pressure feels good and comfortable to you. All the way down. Deep breath. This is a big one that loves to hold tension. We did a little stretching with this again in thread the needle pose, but now we're really on it. And I want you to assess which side feels tight to you. Maybe it's both. For me, it's the right side. And again, we're right in this space right here. You can find this because if we follow our jaw all the way back to this little bony prominence behind the ear here, that's where levator attaches up top. So we're going to want to start at that bony prominence and work our way down the neck. All the way down. You might feel your ears pop. That's kind of common with this one. What we can do again, sometimes this can refer up into the head if this is in fact where we're getting our headaches from. So if you start to feel like your head's getting a little bit tight, that's actually normal and a good sign that you found a muscle that has some tension. So if that does happen, you can refer yourself back to this head massage a little bit. Just open this up. Make sure you give yourself a nice little head massage. And we're going to do one more pass back there, this time even just a little bit slower. Start at that bony prominence behind the head. And we're just going to work our way all the way down. Nice and slow. Breathing, just trying to relax the jaw here, trying to relax the head, the shoulders. Nice and easy. Bring out the neck. And when you get to the shoulders, what we're going to do is this time we're going to spread it all the way down the shoulders. And we're going to just trace around the clavicle. Until we get to the sternum. Into the sternum, we're going to trace back around the clavicle. And come right back up. Again, just always make sure you're bringing that fluid down. We're moving a lot of stuff here. So you can give yourself a little, we call this pectorsage, a little pumping here, a little pumping action at the neck. It's always very helpful, a little pumping action at the shoulders. You can go all the way down onto the shoulder if you want. This one's one of my favorite things to do. You should get both sides. Again, this is actually, this petrissage here, this technique, this pumping is also helping to move fluid. So when we're done pumping, we're going to do the same thing. We always bring it right back down, glide it back down. Very important. Don't want the fluid staying there. We want it all out. Now, here's the last one we're going to do. We've worked with the masseter muscle. We've worked with the muscles of the face here. We've worked with levator scapula, and now we're going to work on scalene. And you can find scalene because if you know where this bony prominence is, it's the same attachment as levator. Levator is going down the back. Scalenes is going down the side. So if you palpate right here on the side, you'll find these bands right here on the side. And scalenes, the scalenes controls our lateral flexion to the side as well as our rotation here to the opposite side. So this left scalene, for instance, does left side lateral flexion, and it does right side, opposite side rotation. So really important because this is a super used muscle all the time, especially if you're sitting at your desk, you're using one side of your arm to lean on, or you have mouse hand, anything like that. This is a very overused muscle. So we're gonna do the same gliding action we did down levator scapula, and we're gonna do it with scalenes here. Start right at the top. All the way down. To the bottom. We're only going to go about 3/4 on this one. We don't have to go all the way. When you've got about 3/4 the way down, we're just going to drag our fluid down. Again, starting up here behind the jaw, find that band on each side, real slowly. All the way down to about 3/4 the way down. Don't need to go all the way down to the clavicle, just about halfway to 3/4 the way down the neck. And we're just going to bring all that fluid forward. We can do now, if you'd like, put your hands right on your clavicles. Don't have to dig yourself in. Just put your hands right here. Gentle stretch down, lean the head forward, and then we're just going to gently, with our hands staying stationary, lean our head back. If you like an even greater stretch in here through the neck, you can close the jaw. One more time, head down. Deep breath. Coming to the close of our session here. We're just going to lean our head back. Opening up that neck. When you're ready, you're going to sit in a nice, comfortable position. We're going to just end with a little bit of breathing here. Did a lot of fluid movement today out of the head and neck. So I want you to just sit with that. How are you feeling right now? If you were having some allergies, any postnasal drip, any worry from that sort of stuff, how are you feeling right now? Has it moved out? I know for me, all the stuff that was in my ears, it's moved out. It's starting to move. Sometimes this takes a little while. Just take some deep breaths. Relax the shoulders. All right, guys, I'm not going to make you turn on your cameras, but I'm curious to see how you're feeling. Olivia and Andrew, my two classmates.
Good. The ear stuff was so helpful.
Oh, right?
Yeah.
Yeah. Who am I listening to? Andrew or Olivia?
Andrea.
Andrea. Pretty nice, right? Especially like I feel like there's a lot of allergy stuff going on right now, even like cold stuff that's happening right now.
Yes.
Definitely a good resource for just getting rid of that gunk.